Hello, my name's Charlotte and we're at Skylark Vets. Today we're going to talk about giving oral medications to birds, which can be a bit challenging. So this is Troy, he's a little budgie. Say hello, Troy. And Troy needs some antibiotics. So the first thing to say is when we're working with birds, you're often going to be working with really small doses on a syringe. So this is a 1 ml syringe. I don't know if you could just zoom in for me. You can see some tiny, tiny lines down this syringe. When we measure the dose, we're counting in those tiny lines, and it's the very top part of the black plunger on those tiny lines that we're measuring. So just this part of the plunger here. So Troy needs 0.05. So we literally take our medication, which in this case is a thick antibiotic, so we give it a nice shake. Not all of them can be shaken. And then you pop your syringe in. Now it doesn't matter if you get a little bit of an air bubble in your syringe, like you can see there, because these are designed to measure with that in mind. So all that matters is that you have the plunger on the 0.05. So what I'm going to do is just start again. So pop that in, draw it up, take it out, have a look at where your plunger is, and then just push it back so you get to the required dose. So as I say, at the moment it's 0.05. Now this medication is particularly disgusting, so Troy's not going to like this very much, but that's a good way of showing you. So some birds, you can literally offer them a syringe and they'll chew the end, like Troy is doing here. And that's very, very helpful. You have to remember that they only got a small space in their mouth, so try not to put huge volumes in, but if you can put a little bit in at a time, so 1 drop at a time, that's great, and you can do it with them chewing. If you can't do that, sometimes what I do is tip them on their side. Can we just move your feathers, Troy? Tip them on their side, and you can see there's a gap between their upper and lower beak, and I just use the syringe to just nudge in there and pop the drop actually at the side of their beak so it comes in at the side and they can take it that way. That's quite a good way for medications like this one that taste disgusting. But as I say, if they will chew the syringe, then you can just do it a drop at a time.